Hi, my name is Wendy Leonard, and I'm the founder and executive director of the Ihangane Project. We are achieving lasting improvements in health outcomes in Rwanda by promoting local innovation within the existing national health system. We believe that nurturing this relationship between nurses and mothers is essential for long-term healthy communities, and we promote local health system designs that strengthen the ability to provide and receive care at the community level. So why does designing a local health system that supports the healthcare worker-mother relationship matter? Well, I'd like to introduce you to Odette. Odette brought her daughter to a rural health center in Africa. Nurses were overwhelmed by the number of patients and lack of needed resources. Odette and her daughter finally do see a nurse. The nurse checks the baby's height and weight and writes the numbers on her hand. She does not have access to the baby's measurements from previous visits. She estimates that the baby has moderate malnutrition, and the nurse tells Odette to breastfeed more and come back in a month. Because the nurse seemed too busy and distracted, Odette didn't mention that she couldn't breastfeed because of a breast infection. When she returns 1 month later, her daughter is diagnosed with life-threatening severe malnutrition. Her daughter is hospitalized for 5 weeks, and luckily she gradually improves. But imagine the suffering that could have been spared and the resources saved if the nurse had noticed Odette's daughter had lost weight compared to the previous visit and had had time to ask Odette about these changes. Well, what if instead Odette's nurse had a tablet that she wore around her neck? When she entered measurements, she would see all of the previous measurements over time with color codes for the nutrition status and real-time data trends that she could share with Odette while providing health education on ways to prevent malnutrition. She could even print a copy of this report to give to Odette. Well, this is possible with eHEZA Digital Health Record. eHEZA is a permanent health record for pregnant women and their children with the potential to become a full family health record over time. It is designed by and for nurses and mothers to support their workflows and group health assessments that are typical in Rwanda and throughout East Africa. It inspires healthy behavior change by allowing nurses to share real-time growth trends with mothers while providing health education and reinforcing healthy choices. It delivers reliable and timely data to the Rwanda Ministry of Health, and it's a revolutionary approach that demonstrates it is possible to design implementation tools at the community level that facilitate adoption of national health strategies while also addressing local needs. Our talented team is the key to our success. Our data specialist, Teo, who's with us today, leads the Ihangane Project's eHEZA team in Rwanda. She has worked with frontline nurses and mothers since 2013 to inspire behavior change through the use of data trends. The nurses and mothers that she works with are excited to participate in creating eHEZA Digital Health Record. We have partnered with experts in software development at Gizra Internet Solutions and specialists in human-centered design at Greater Good Studio to join us in creating eHEZA. In April of 2017, we received the funding needed to create our pilot product. By June, we had contracted with our partners, and over the next 6 months, we conducted 3 development sprints, engaging nurses and mothers at each stage of the process. We will complete our pilot product later this month. Securing $250,000 would allow us to bring eHEZA to scale in Rwanda. This year, we will pilot eHEZA in 9 health centers while adding functionality and establishing the connection with the Ministry of Health data reporting system. By 2019, we will expand eHEZA to 21 additional health centers and refine the product based on user feedback. By 2020, the product will be fully functional for all maternal-child health care and expanded throughout Rwanda. This will allow us to improve the quality of care to 4,000 mothers in 2018, 55,000 mothers in 2019, and 240 mothers in 2020. The challenges of healthcare workers in Rwanda are not unique. eHEZA is designed with key features that support its expansion through ministries of health around the globe. It is guided by gold standard World Health Organization guidelines adopted by many countries around the world. It links to DHIS2 which is a health data management system used by over 60 countries, including Rwanda, and it can shift between individual care and group health assessments to provide workflow flexibility. Although our initial product focuses on maternal-child health, any number of new modules can be added to address other chronic conditions such as diabetes, HIV, or heart disease. And our partners are excited. The Rwanda Ministry of Health sees EHESA as a solution to the challenges they face in terms of accessing timely and accurate data, especially as it's related to their fight against childhood malnutrition. They consider the Ihangane Project to be an integral part of their e-health strategy. And Dr. Ngira Bega, who's shown here, is the Deputy Director of the East Africa Health Research Commission, which is leading the e-health strategic plan for East Africa. He is observing our work in Rwanda with the hopes of sharing EHESA with their member countries. We plan to scale EHESA through government adoption, and our open source business model allows for collaborative iterations and cost effectiveness. The Ihangane Project is well positioned to generate revenue to sustain our work through the provision of code support and support contracts, implementation and design expertise, and building of new modules and integrations for clients. We invite you to partner with us in creating EHESA. It is a digital health record with great potential for impact and scale. From mothers to healthcare workers to the Ministry of Health, EHESA achieves impact at each step along our value chain. It is a revolutionary bottom-up approach to health system design, and you will be a part of a team that delivers. Thank you very much.